Will IVF be successful with a low ovarian reserve valued at 4 out of 10 and only 3 eggs visible on the ultrasound? Come on, don't let yourselves be disheartened. The girls today are feeling quite scared and very anxious. We are living in an era where the average age for marriage is steadily advancing and young women are now pursuing education and entering the workforce. And the circumstances for young men are unfortunately not the most favorable. Marriage, after all, is a matter of destiny. But every single girl has the absolute right to choose the correct life partner who will truly appreciate and understand her. Girls today are waiting for a life partner, and the partner of life still hasn't arrived. But what you absolutely must understand is that God Almighty created you with a very specific number of eggs. These eggs are approximately 400,000 in number at the time of your birth. And by the time you reach puberty, this number drops to about 200,000. And after that, with every single menstrual cycle, your body loses approximately 400 eggs. A woman who gets pregnant and gives birth frequently will lose more eggs. Also, a woman who has previously undergone attempt for conception and had IVF, her ovarian reserve does not necessarily diminish. However, afterwards, we might find the number of eggs she produces is fewer because the ovary is indeed affected by the egg retrieval procedures. And another very important thing you need to understand is that God Almighty created you with a specific number of eggs. Whether you get married or not, whether you get pregnant or not, every single month you will lose a certain number of eggs. Pause. Okay, doctor, I went for IVF and found my ovarian reserve was low, less than 1. Pause. So is it true? Let's find out what is the normal ovarian reserve amount. The natural ovarian reserve typically ranges from 1 to 3.5. If the reserve level is 4, this indicates a high reserve, which is often linked to what? It's linked to polycystic ovary cases. Polycystic ovary cases have many eggs in the form of cysts, and they also have a high ovarian reserve from 3.5 and above. But what is it? These individuals, besides having a high ovarian reserve of 3.5 and above, also experience significantly poor egg quality. This inherent poor egg quality they possess ultimately predisposes them to a medical condition known as infertility. They become more susceptible to infertility and are at a higher risk of delayed conception. And it can also be linked to a higher failure rate for IVF procedures because their egg quality is often poor. Furthermore, women with PCOS often experience poor ovulation, and this weak ovulation makes me wonder, what do I have to do next? When I monitor ovulation, I don't find that the woman, for instance, during her expected ovulation period, which isn't a fixed time. If your cycle is every 28 days, then we say the 14th day of your cycle is ovulation day. But if your cycle is every 30 days, then the 15th day of your cycle will be ovulation day. So what you need to know is that the ovulation period for women naturally differs from day to day between cycles. And by taking the first day of bleeding in month 1 and the first day of bleeding in month 2, the exact midpoint between these two dates represents the ovulation period. Women whose menstrual cycles are irregular find it quite difficult to accurately calculate ovulation. And we did mention that there are many signs to monitor ovulation using ultrasound. I can see the uterine lining appearing as 3 distinct lines, and I also observe follicles on both ovaries, with the follicle size being at least 18 to 20 millimeters for pregnancy to occur. Even though the woman complains of ovulation symptoms, she tells me, "Doctor, I have lower back pain and lower abdominal pain." And also, doctor, at the same time, besides the pain I'm experiencing, I feel my breasts are heavy, my mood is changing, I have a lot of clear discharge, and my sexual desire increased during the ovulation period. So I tell her, this is exactly what I want to convey to you, that these are the signs of ovulation in women, and it makes me emphasize the importance of having intercourse for the purpose of achieving pregnancy. And we also need to discuss something else. What truly matters for a woman? Is it the number of eggs, or the ovarian reserve level, or the quality of the eggs? But first, let's concentrate on this. Doctor, what is considered a normal ovarian reserve? I told you, it's from 1 to 3.5. So doctor, what matters more to you, the number of eggs or their quality? I'm telling you, it's their quality that truly makes the difference for me, because a 20-year-old patient with polycystic ovaries produced 20 eggs during her ovulation. The majority of these eggs are of poor quality. However, another patient who is 35 years old produced 2 eggs for me. If their quality had been better, it would have made a significant difference for me, leading to success with ICSI. We're talking about the 35-year-old patient, not the 20-year-old. My second or perhaps third important question is, doctor, how exactly do you calculate ovarian reserve? We calculate it in 2 ways. First, with ultrasound imaging, we perform an ultrasound for you on the 2nd or 3rd day of your cycle, and preferably an internal vaginal ultrasound. We then count the number of follicles, which are what? Those produced by the ovary. This month, the ovary might produce 10 eggs. Next month, it might produce 5 or 6. So, through a transvaginal ultrasound, we determine something called antral follicle count, which means counting the follicles. And we also check the ovarian reserve level through a blood test. The third thing I want to tell you is that the success of ICSI depends on several factors. Most importantly, the woman's age. From age 20 to 35, the chances of success are higher with ICSI. From age 35 and above, the success rates of ICSI decrease. The more a woman's age advances, the lower the success rate of ICSI becomes. Point number 2, and this is extremely, extremely important. The quality of your eggs is what truly makes the difference. Are you overweight? Your egg quality is low. Are you a smoker? Then your egg quality is low, and you don't play sports either. Your egg quality will be low. Are you always feeling stressed and depressed? Your egg quality is low. Are you eating too much? Your egg quality is low. Are you drinking too much coffee, Nescafe, and caffeine? Your egg quality is quite low. Is it your lifestyle? Do you often stay up very late? Your egg quality is quite low. Are you waking up too late in the morning? Your egg quality is quite low. Stressed all the time? Your egg quality is low. Are you always depressed and constantly glued to social media? Your egg quality is low. Modern studies show that people are spending more than half their day on social media platforms, which naturally leads to more depression, more stress, more scandals, and more bullying. So, for our episode's topic, if the ovarian reserve is 0.4 and she's produced 3 eggs, can she conceive? The answer is yes, because even with a low ovarian reserve, I'll inject you with ovulation stimulants, and if you've produced 3 eggs on the ultrasound, that means you could potentially give me 3 embryos. But doctor, is it a fixed rule that 3 eggs mean 3 embryos? The answer is no. It's not a fixed rule that 3 eggs mean 3 embryos, but it's possible, yes, that the 3 eggs I got resulted in 3 embryos. The whole idea with ICSI is I'll have you come in on the 2nd or 3rd day of your menstrual cycle, then we'll count the eggs using an ultrasound, and I'll check your ovarian reserve. This helps me determine the precise stimulation dosage I need to administer. The older you get and the lower your ovarian reserve becomes, the more stimulation doses you'll require. And I stimulate you for a period of 10 to 12 days. Then I administer what is known as the trigger shot to ensure that the eggs reach their full maturity stage and progress from the primary to the secondary division. The secondary division is the optimal division for achieving a successful pregnancy. And after that, I proceed to retrieve the eggs under full general anesthesia. Then what does the lab do? It examines the fluid from these eggs. I find the nucleus of your egg, and then I proceed to fertilize it with the sperm. I place them in specific culture dishes within a particular growth medium, and I wait for them to grow and mature. And after they grow and mature, I then tell you, for example, we got 1 embryo, 2 embryos, or 3, graded 1st, 2nd, 3rd, or 4th. There are what we call day 3 embryos and day 5 embryos, and I'll give you a more detailed explanation about them in a complete topic on IVF later, so that when you come to my hospital for IVF, you will understand absolutely everything. We will transfer the embryos back to you in a very simple procedure without any anesthesia, along with stabilizing the uterine lining. I hope today's episode has benefited you and provided you with new information. You've been with Dr. Haya Hijji, an obstetrician and gynecologist. Thank you.